Hello everyone, welcome to Patho Excellence. Today we will discuss endometrial dating. Endometrial dating is one of the most essential skills in gynecological pathology. By carefully examining the glands and stroma under the microscope, we can identify the exact phase of the menstrual cycle and correlate it with the patient's hormonal status. This is not only helping in evaluating infertility but also in detecting hormonal imbalance and endometrial disorders. Today, let's break down the key histological changes step by step so that you can confidently date an endometrial biopsy in your exam as well as in clinical practice. And yes, if this session adds value to your learning, kindly like, share and subscribe. You can also post your comments or questions below. I will be happy to address them. Let's begin with the normal menstrual cycle. It is the complex coordination between pituitary ovary and endometrium. In average 28 days of a menstrual cycle, in day 1 is in menstrual phase where estrogen and progesterone are low, which triggers hypothalamic gonadotrophin releasing hormone, which ultimately releases pituitary, releases FSH and LH. So these are ovarian follicles, estrogen and progesterone, follicular stimulating hormone and luteinizing hormone. So first phase is follicular phase, which is from day 1 to 14, where FSH recruits multiple ovarian follicles and one becomes dominant. The growing follicle secretes estrogen, promotes endometrial proliferation, where glands are straight, stroma compact, and mitosis are thick. This rising estrogen provides negative feedback on FSH, ensuring only one follicle matures. Second phase is ovulation phase, which is ovulation day 14, where estrogen is high and there is sustained feedback flips from negative to positive, which induce LSH surge. So follicle ruptures and ovum release. Now ovulation usually occurs 36 hours after the LH peak. Now second phase is luteal phase, which is from day 15 to day 28. So post ovulation, the follicle transforms into the corpus luteum, which secretes progesterone and estrogen. Progesterone converts the proliferative endometrium into the secretory endometrium, where the glands are looking like sawtooth appearance, having stromal edema and spiral artery development. If fertilization occurs, human chorionic gonadotropin hormone maintains corpus luteum. If not, corpus luteum regress after 24 days. There is sharp fall in estrogen and progesterone and menstruation begins. So hormone withdrawal causes vasospasm of spiral arteries, ischemia, necrosis and shedding of functional endometrium, and again cycle restarts. For dating, 5 features affect the glands and 4 features relate to stromal changes, which are important for endometrial dating. One is in gland, one is tortuosity, gland mitosis, orientation of nuclei like pseudostratified versus basal nuclei, basal subnuclear cytoplasmic vacuolization, luminal secretion with secretory exertion. In stroma, we have to see edema, mitosis, pre-decidual change, and infiltration of granular lymphocytes. So in this diagrammatic view, we can see gland mitosis indicates proliferation. So proliferation increases in the proliferative phase or follicular phase, and it is because of menstruation. In menstrual phase, there is repair and breakdown are progressing. Then second is stromal mitosis. Stromal mitosis are most abundant during the proliferative phase and absent during active secretory phase and reappear during the stage of pre-decidual formation. Second thing is tortuosity of gland. Gland development parallels endometrial thickness. It has two phases. Earliest stimulated by estrogen. During secretory phase, tortuosity becomes pronounced, paralleling the secretion curve. As secretion increases, tortuosity increases. Third, pseudostratification of nuclei. This is characteristic of the proliferation phase but persists until active secretion begins. It is not resumed until the glands have involuted during the menstruation. Basal vacuolization. This is the earliest morphological evidence of ovulation found in the endometrium. It begins approximately 36 to 48 hours following ovulation. Secretion. This curve represents visible secretion in the gland lumen. Active secretion falls off more abruptly, and in the later stages, the secretion becomes inspissated. Edema. This factor varies with the individual, particularly the rise during proliferation and may be almost absent, and the edema which accompanies secretion is more constant. So in secretory phase, you can see extensive edema in mid-secretory phase as well as in mid-proliferative phase. Pre-decidual reaction. This is evident first around the arterioles and progress until just before menstruation. The superficial compact layer is found at this phase. Leukocytic infiltration. Throughout the cycle, there is always a few lymphocytes. Polymorphonuclear infiltration begins about 3 days before the onset of flow. So these are important features to see in glands and stroma according to the phases. Now histological features, if we see in proliferative early, mid and late phase, in glands we can see small straight glands with mitosis, dense spindle stroma along with mitosis and relatively inconspicuous spiral arteries within this wall. So in early stage, these are the features. In mid phase, slightly tortuous glands are present and edematous loose stroma with spindle cells. In late proliferative phase, pseudostratified appearance, nuclei are at various heights but most in basal half, smooth luminal surface and lumina sharp outline. There is less edematous stroma and there is inconspicuous spiral arteries in whole proliferative phase. Now, post-ovulatory day 1, it is called interval period where mitosis is there, subnuclear vacuolization is there, but not all in all glands. We will see definition later on, and there is no change in stroma and it is like proliferative phase. Early or post-ovulatory day 2 and 3, there is tortuous gland Post-ovulatory day 4, less regular subnuclear vacuoles and secretory vacuoles on luminal side. So, subnuclear and few supranuclear vacuoles. POD 5, 6, 7, 8 and 9, if we see in this days, gland shows irregularity, widening of diameter, papillary infolding, sawtooth appearance, no pseudostratification, apical surface is rough, indistinct nuclei, which is round, vesicular and pale staining. Here, this is the mid-secretory phase where edema starts, and therefore we can distinguish basal from functional, and date 8 shows maximum edema. Right? And edema start to regress at day 9, POD 9 or day 23. POD 9 or day 23 shows spiral arteries appearing more prominent. Day POD 10 and POD 11 shows formation of decidual change, and there is pre-decidual cuffing of spiral arteries. Here POD 12 or day 26 show sawtooth endometrium with secretion, tall columnar epithelium, and surface may have flat to cuboidal cells and some luminal breakdown. Here the stroma is solid, no edema, superficial still decidual change and granulated lymphocytes. POD 13, 14 or day 27 and day 28, same changes in the gland, and after that menstrual phase begins where glandular collapse, clumped epithelial glandular cells with secretory exhaustion, stroma shows crumbling and compact ball formation over the overlying the epithelial cells, and vessels show thrombosis. So these are the histological features according to the days. This is a decision tree for endometrial dating, where we have to see first glandular epithelial type, whether it is proliferative or secretory. We will see it in later on. First, this is a decision tree where you have to see gland. So, proliferative gland, if present, either it may be early, mid, late or interval phase. So, is the gland straight or coiled? If straight, it is early proliferative. If coiled, it is mid proliferative, late proliferative, interval. Now, see stromal edema. Present? Yes, then it is mid proliferative. Absent, so it is late proliferative or interval. Now, are these scattered subnuclear vacuoles present, but with less than 50% of the gland exhibiting uniform subnuclear vacuolization? If it is absent, then late proliferative phase. If it is yes, interval phase with consistent with the but not diagnostic with the post-ovulatory day 1. Now, if glands are secretory and vacuolated, then it is early secretory phase. So, post-ovulation day 2 shows subnuclear vacuolization uniformly present, leading to exaggerated nuclear pseudostratification. Greater than 50% of the glands exhibit uniform subnuclear vacuolization and mitotic figures are frequent. In interval phase, less than 50% of the glands show uniform subnuclear vacuolization, and in early secretory phase, there is more than 50% of glands showing subnuclear vacuolization. Post-ovulatory day 3. where subnuclear vacuoles and nuclei uniformly aligned and scattered mitotic figures are there. POD4, vacuoles assume luminal position, mitotic figures are rare. So now the subnuclear vacuoles are going towards supranuclear position. So vacuoles are assumed luminal position at POD4. POD5, vacuoles are infrequent. Secretion in lumen of gland. Cells have a non-vacuolated secretory appearance. So secretion begins. Now see secretory gland non-vacuolated, then it is mid-secretory or late secretory or menstrual phase. Then now see the stroma. If you have seen glands are having secretory changes, then you go for stromal changes, whether pre-decidualization present or not. If no, it is mid-secretory phase. Now in mid-secretory phase, POD6 shows secretion prominent, POD7 where stromal edema begins, POD8 shows maximal stromal edema. Now if stromal pre-decidualization present, then it is late secretory phase or menstrual phase. Now see the stroma. If crumbling of the stroma present or absent. If no, then the late secretory phase. So POD9 where you can find spiral arteries first prominent. POD10 shows thick periarterial cuff of predecidual change. POD11 island of predecidual in superficial compactum. POD12 beginning colons of islands of predecidual. POD13 this surface island shows stromal granulocytic presence. POD14 extravasation of red cells in stroma and prominent of stromal granulocytes. So superficial compactum layer is present at the day POD11 in late secretory phase and excessive amount of stromal granulocytes are all present in POD14 phase. Now crumbling of stroma present, then it is menstrual phase where you can see crumbling stroma, hemorrhage, intravascular fibrin thrombi, stromal granulocytes in prominent, polymorphs are present, and late menstrual phase show regenerative changes prominent. So this is how you have to see the slide, and you see one by one gland and stroma, and these are the changes. So here same thing, first you identify whether the glands are proliferative or secretory. Now secretory is easy to identify with the presence of vacuolization. So if vacuoles are present, then it is early secretory phase. Absent, then you see stromal pre-decidualization. Now if it is absent, then it is mid-secretory phase. If it is present, late secretory phase. And in mid-secretory phase, you will see luminal vacuoles. Luminal vacuoles are seen in the early secretory phase. There is absence of cytoplasmic or infrequent cytoplasmic vacuoles. Glandular secretion is prominent and stromal edema is maximum in mid-secretory phase. Right. Now, in late secretory phase, day 8 shows spiral arteries prominent and beginning of predecidualization of stromal cells surrounding the arteries. Day 10 shows thick periarterial cuff of predecidual. 11 day shows lymphocytes are increasing in number. At day 12, there is presence of apoptosis and lymphocytes. Day 13, solid compactum formation, which is the layer beneath the surface epithelium of the endometrium, and there is luminal polymorph nuclear cells. Day 14, there is interstitial hemorrhage, apoptosis, luminal polymorph cells. So this is how you can identify secretory phase. Now, proliferative glands are there. Then you see whether coiling is present or absent. If it is absent, then it is early proliferative phase. Coiling present, yes, then you see stromal edema. If edema is absent, then it is late proliferative phase. But if edema is present, mid proliferative phase. So, you will find edema at two times. One is mid proliferative phase and second is mid secretory phase. But where you have to see the glandular change. Now, menstrual phase generally is identified by plumbling stroma, stromal granulocytes, and regenerative changes along with the polymorphonuclear cells. And interval phase where you find both the change like proliferative change as well as secretory change in the form of glands show pseudostratification in some part and some part show patchy subnuclear vacuolization, and glandular and stromal mitotic figures are fixed. So, you will identify exact phase by looking at stroma, gland, and vacuolar changes in the gland. So, proliferative base is having different duration in different person, even in same person at different time period. So, there is a great variation, and it is 9 to 20 days phase and average lasts for 10 days. During this phase, endometrium grows from 0.5 mm up to 4.4 to 5 mm in thickness. So this is section shows proliferative endometrium, which is showing tubular gland with compact stroma, no coiling. So this is the early proliferative phase. In mid-proliferative phase, we have discussed edema is present in stroma. Spiral arterioles are not that thick, which we can see in secretory phase, and most important is glandular coiling. So, glands are in the form of coil and stromal edema, and they are placed parallel to each other. In mid-proliferative phase, edema, thin-walled spiral arteries, stratification begins here and stratified glands are there. In late proliferative phase, columnar epithelium are present with pseudostratification of nuclei, but edema is absent as compared to mid-proliferative phase. This is glandular coiling. This is surface epithelium. Glands are regularly placed and gland to stroma ratio is 1:1. Here you can easily identify pseudostratified nuclei with mitotic activity. So, in proliferative phase, you have to see mitosis in glands as well as mitosis in stroma. And some scattered lymphocytes are seen in the proliferative stroma. So, these are the mitotic figures, and this is called pseudostratification of the nuclei. Now, interval phase is included in secretory phase. So, it is divided into 4 periods: interval, early secretory, mid and late secretory. First 24 to 36 hours of the secretory phase are morphologically silent and retains its late proliferative appearance as well as scattered non-uniform subnuclear vacuoles. So this is called interval phase, where you find less than 50% of the cells in a gland with continuous and well-developed subnuclear vacuoles along with some stratification. So here in this section you can easily identify this is the stratification, and some of the glands here show subnuclear vacuolization, right? So stratification and subnuclear vacuolization with mitosis in the gland. So this is interval endometrium. Two features are seen in glands, and this is the section showing pseudostratification, and some part of the gland show patchy subnuclear vacuolization. And this is interval endometrium maintaining proliferative phase along with subnuclear vacuolization, and this type of subnuclear vacuolization is not sufficient to be certain ovulation has occurred. Whenever ovulation is present, there is excessive amount or more than 50% of glands show subnuclear vacuolization. Secretory phase, where the glands and stroma develop in somewhat orderly sequence, displaying histological features of post-ovulation secretory activity. Endometrium attains a thickness of up to 7 to 8 mm. Unlike the proliferative phase, the changes in the glands and stroma are relatively discrete, changing more abruptly from one day to the next. So in the first half of the secretory phase, they are characterized primarily by glandular changes, and in the second half, stromal alteration become more prominent. The morphological changes of secretory phase begin within 48 hours after ovulation. The length of this phase is constant, 14 days, and this constancy that provides the basis for endometrial dating. Nowadays, due to the sensitivity and specificity of serum hormonal studies, it is exceedingly rare for the surgical pathologist to be called upon to date the endometrium for infertility purposes. However, given the prevalence of polycystic ovarian disease, dysfunctional uterine bleeding, and iatrogenic hormonal use, it remains important for the surgical pathologist to recognize when ovulation has occurred and the normal responses of the endometrium to various hormone stimuli. Now, in early secretory phase, we can see subnuclear vacuoles and nuclei retain the dense chromatin of the proliferative phase, uniformly present cytoplasmic subnuclear vacuolization, which is the most useful marker of the first third of secretory phase. In early secretory phase, you will find subnuclear vacuolization. Now, mid-secretory phase, hallmark features in these three diagrams showing its low power. There is excessive glandular coiling, stromal edema, and this coiling here is associated with formation of a prominent spiral arterioles, along with pre-decidual reaction surrounding the spiral arterioles has not occurred in this phase. So, prominence of spiral arteries, edema and glandular coiling. Here, the characteristically round vesicular nuclei of the mid-secretory endometrium are apparent. In late secretory phase, you can appreciate sawtooth or serrated glands, so appearance, and the stroma shows pre-decidualized change. This change starts surrounding the spiral arteries and then in the whole tissue. This is a pre-decidual reaction in high power view showing granular lymphocytes, and these are the stromal cells having abundant pink eosinophilic cytoplasm and regular or visible outline. So we can differentiate mid-secretory phase with the late secretory phase by absence of edema, prominence of spiral arterioles with pre-decidualized stroma and sawtooth appearance of gland. Here, if we see day by day, so here day 1 shows pseudostratification and patchy subnuclear vacuolization. In day 3, we can see prominent subnuclear vacuolization and some of the mitotic figures. Day 3 and 4, where maximum subnuclear vacuolization, nuclei are pushed towards the luminal border. Day 4 and 5, where subnuclear vacuolization and supranuclear vacuolization. So this is POD 4 and 5. POD 6 and 7 shows dilatation of glands, irregular of luminal border and secretory blebs on the luminal aspect. Day 8 with basal nuclei, secretion in the lumen and granulocytes surrounding the spiral artery. Day 8 and 9, there is sawtooth appearance of the glands. Here, prominent spiral arteries and edema and basal nuclear position. So this is pre-decidualization of stroma surrounding the artery. Stratum compactum, you can see this is stratum functionalis, stratum compactum, mostly seen in late secretory phase. There is a relative absence of glands here in compactum, and stroma is compact, that's why it's called compactum. This is spongiosum, which contains tortuous gland and sparse stroma. Menstrual phase. So menstrual phase, the gland shows secretory exhaustion. There is disruption of the dilated glands that are lined by flattened cells showing frayed border. Apoptosis is seen in the glandular epithelium. There is marked infiltration of stroma by the endometrial granulated lymphocytes. These dark blue dots are granulated lymphocytes, and you can also see polymorphs. Then the coiling of the spiral arterioles is accentuated due to the collapse, and the stroma is markedly condensed. Now, premenstrual endometrium in late secretory phase at day 14, you can see here a apoptotic nuclear debris at the base of the cell. So these are the changes demonstrating premenstrual endometrium. See, here beneath the nucleus or at the base, you can see some dark blue debris, which are the apoptosis. Menstrual endometrium, severe stromal hemorrhage is present, free decidual cell collapse and lose their cytoplasm. So you can see only nuclear groups, hemorrhage, condense and collapse stroma. So it is called stromal breakdown, and some artifactual glandular crowding and telescoping. So these are the changes suggesting menstrual endometrium. Here, this section shows small vessels accumulated fibrinous thrombi. So this is the fibrinous thrombi. These are the stromal blue balls because of collapse of stroma, and they are fragmented stroma detached from endometrial glands, and the endometrial glands show artifactual crowding and basally placed nuclei. Some of the glands here still show secretory changes. Here again, degenerated glands, some irregularity, mark hemorrhage, and compact or condensed stroma. Here, fibrinous material or fibrin thrombi within the spiral arterioles, some vacuolization. Here, some glandular show excessive secretory changes. Now, second important thing is to see gestational changes, where decidual change is present. In this, stroma gains abundant eosinophilic cytoplasm, where it appears polygonal with distinct cell borders. There is stellar reaction in glandular cells, nuclear enlargement and hyperchromasia, abundant eosinophilic vacuolated cytoplasm, and hobnail appearance with cell protruding into the glandular lumen. So this is hobnail appearance, where nucleus is protruding in the lumen. So this is hobnail appearance. This is hypersecretory pattern in the early pregnancy with focal area stilla reaction, where abundant vacuolated cytoplasm in the cell. These are the vacuolization of the cells of the gland, and you will find decidualized stroma in these changes. Now, atrophy. It is common in postmenopausal women due to estrogen withdrawal. Glands composed of inactive low columnar to cuboidal cells. Glands often detach from stroma, forming hairpin structures. May have cystic change. Cystic atrophy is associated with postmenopausal tamoxifen or breast cancer. So here you can see surface epithelium. This is the endometrium and myometrium. So this is endometrium, where here it is very thin and populated by scattered cystically dilated glands with atrophied epithelium. Again, a section shows atrophic endometrium, showing in endometrium basally placed gland with proliferative or inactive glands with few cystically dilated glands, and this is myometrial. And in endometrial biopsy, atrophic endometrium shows detachment from the stroma of the gland, and it looks like hairpin appearance where the gland is composed of low columnar to cuboidal cells. So, in this way, if you see gland stroma and vacuolization, you can identify. You can easily identify endometrial phase and you can date it. So, I hope this session will helpful for your biopsy interpretation. In next session, we will see indications for endometrial biopsy, some pitfalls in this assessment, artifacts, and some clinical queries and reporting. Stay tuned. Thank you.